After these wonderful operating techniques and wonderful endoscopic sinus surgery, I can only continue with what should we do with those patients after the surgery. As you know, functional endoscopic sinus surgery is the modern approach to the surgery on the sinuses, which you already saw lecture before. There are many indications for endoscopic sinus surgery, such as you saw it before, but beside that, you can operate it patients with a chronic sinusitis refractory to medical treatment, nasal polyposis, excision of selected tumors, dacryocystorynostomy. I don't account you all the things, you can read it. At the end, the epistaxis control. After the endoscopic sinus surgery, wound healing of the mucosal lining is highly organized, well-coordinated process involving coagulation, inflammation, cell proliferation, matrix deposition, and a remodeling phase. Hosemann described on his lecture on endoscopic observation of the normal wound healing. He described it with the 4 phases. The first phase is the phase of the blood crusting, which travels from the 1st till 10 days. The second phase is the phase of obstructive lymphedema, which goes up to 30 days. Then comes the third phase, the phase of mesenchymal growth, up to 3 months. And the fourth phase is the phase of scarification after 3 months. Xiu Geng described it in the peaks. They're a little bit similar, but a little bit more divided. The first peak is the peak of divided on 3 stages. The first stage is from the 3rd till 5th day with the dry and hard blood crust. The 7th from the 10 days is relieved of edema, reduction of the secretion, and after 10 days there is a clean operative cavity. On the second peak, from the 3rd till 10th weeks, there is a recurrence of edema, lymphatic obstruction with vesicles, granulation tissue, mini polyps, and fibrous adhesion. On the 3rd peak, after 10 weeks, there is a stage of clean epithelialization. This is the endoscopic view of these phases and the peaks. As you can see on the first phase or first peak, you can see the blood crusting, dry and hard blood crust. From the 7 till 10 days, you can see the relief of edema, reduction of the secretion. Then there is a clean operative cavity after the 10 days. After up to 30 days became the obstructive lymphedema phase. You can see the recurrence of edema, lymphatic obstruction, vesicles, granulation tissue, mini polyps, and fibrous adhesion. This is the phase where the operator thinks after operating the nasal polyp that something did wrong, that the polyps come back or they didn't operate it well. But that's not true. That's just the phase of the healing, where the becomes of edema of the mucosa. On the 3rd phase is the phase of mesenchymal growth, up to 3 months. You can see the pictures, and then the scarification became, and the end, the stage of clean epithelialization. If the healing is dominant, the epithelial metaplasia is completed in the end. But if there is dominant of a regenerative phase, there is an incomplete epithelial metaplasia, adhesion, partial or total obstruction of the ostium and sinus cavity. What should we do? What should we have in the therapy after the endoscopic sinus surgery when we saw all those phases of the wound healing after the endoscopic surgery? After the surgery, it is important to take good care of your nose and sinuses to let them heal properly and prevent scars. There are many articles which wrote about nasal douching after the endoscopic sinus surgery. You can see here that some authors wrote that saline douching reduces nasal discharge and may improve edema during the healing phase following endoscopic sinus surgery, suggesting a possible anti-inflammatory role. Some suggest surfactant douching. Also, buffered hypertonic saline is mildly alkaline. Alkaline environment causes the mucosa to be in the sole state. Buffered hypertonic saline solution improves mucociliary transit. Buffered hypertonic saline irrigation should be used in the chronic and postoperative sinus surgery. Also, hypertonic saline enhances the electrical permeability of the nasal epithelial mucosa, but not the transport of a macromolecule in the short term. In the end, some authors wrote that the nasal douching should be done with high volume, low pressure, and it's good for irrigation of the nasal mucosa after endoscopic surgery. What are the benefits of the nasal irrigation? It elevates the nasal congestion due to the reduction of the nasal mucosa edema through osmosis, liquefy the mucosa secret, helps to restore natural function of the nasal mucosa, clean nose cavities from mucus accumulation, crusts, dust, remains, uncleanness, allergens, and infectious substance. And it also moisturizes the nasal mucosa and elevates the dryness. In the therapy, we should say the most important thing is to irrigate with hypertonic saline solution for the 3 weeks. It can be also lavage with the enzymes. It can promote cleaning and healing of the sinus mucosa. Topical drugs can be also good. This is the way of the irrigation of the nose. Systemic drugs can also be written. It depends on the etiology of the pathology for the endoscopic sinus surgery. At the end, the functional postoperative results are directly dependent on the healing quality of the nasal or sinonasal mucosa. That's the reason why we should irrigate the nose after endoscopic sinus surgery. Thank you very much.
Thank you very much. Questions? Thoughts? How do you feel about debridement after surgery of the sinonasal cavity, let's say before the discharge, after a week? Do you think that there is any benefit into that together with the douching?
I think it's benefit.
Okay. Do everybody in the audience, let's see the raise of hands, who is debriding the patients after before the discharge and after a week, and seeing the patient after a week after sinonasal surgery? Who is doing that? Debriding and cleaning the cavity. Everybody, or? Yeah, I see. Few hands, okay. Because I firmly believe that this has a benefit, and it cannot be, it's very hard to make it double-blind, randomized, and make it as an evidence, but we all, there's quite a high expert consensus that this has a benefit in healing, and it shortens the recovery time. Okay. Yeah.
There's one interesting approach. There are people who close off noses post-operatively, but not surgically closing it, but not letting you breathe through the nose for a week or two, no debridement, no douching, and the healing is wonderful. So it's also an option.